Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate through October 13th, 2022. This week I'm going to talk about an issue that is an evolving one, and that is what's going on with the Ebola outbreak in Uganda, and should we be concerned about it? So a little bit of background, there is an ongoing outbreak of Ebola virus disease in Uganda. The numbers are a little bit difficult. You see numbers up to 74 confirmed and probable cases, mostly in the rural western part of the country. Officially, 39 people have died. At least 600 have been exposed and are under observation. The first case was officially confirmed in September, several weeks ago, in a young man who had pretty classic symptoms: high fever, diarrhea, and vomiting blood, but his symptoms had started on the 11th. And the Uganda Ministry of Health has identified this as the Sudan variation, the Sudan strain. There's 4 types of Ebola virus. National and international organizations are taking this quite seriously. WHO has hosted an emergency meeting on cross-border collaboration to make sure that the disease doesn't spread out of Uganda. The United States has announced it will start screening travelers who've been in Uganda within 21 days. And both the U.S. and the European Centers for Disease Control have called on healthcare providers to be alert for folks who have symptoms. A bit of background. Uganda is a beautiful country straddling the equator. Winston Churchill famously called it the Pearl of Africa. And it really is an incredibly beautiful country, and one that's quite important to me because I lived there for several years when I was younger, much younger. And Uganda this is not the first time Ebola outbreak has occurred in Uganda, though this is one of the larger ones. And if you look at where the cases have been, most of the biggest outbreaks, the most recent one was in West Africa, but you see there's been a series of outbreaks with different Ebola virus strains in different parts of Africa. Ebola is more officially Ebola virus disease, but most people just call it Ebola. Is a rare disease, but it is particularly deadly. It probably enters human beings through some sort of contact with animals. Many people think it's bats, but somehow an index case is exposed to blood or body fluids. It then spreads from person to person and can spread quite easily. Even people wearing personal protective equipment have been documented to have become ill, both from patients that are dying and even ones who are recovering, but also those who've already died, which can be a problem in cultures where there are particular expectations on how to handle dead bodies. It was discovered in the 1970s near the Ebola River in the Democratic Republic of Congo. And it reminds us again of the growing movement to not name things for countries or regions or rivers, because it implies some sort of causality that may not be the case. All of the outbreaks that have occurred have started in sub-Saharan Africa, but some have spread outside the country. Symptoms can occur as soon as 2 days after exposure or as long as 3 weeks, but typically 8 to 10 days. That's a pretty long time. That means folks that are, once you develop symptoms, you are infectious and can expose other people. That generally starts with sort of those non-specific fever, body aches, weakness, and then progresses to very severe symptoms, and in many cases, death. The largest outbreak was the one in West Africa in 2014 to 2016. It resulted in over 11,000 deaths, including 4 imported cases and 1 death in the United States. And the images are still pretty fresh in our minds of people trying to protect themselves. And you can see the 3 West African countries were heavily impacted, but even then there were spread to the United States and elsewhere. This also points out that the death rate varies pretty widely across countries, really depending on the ability of the healthcare system to provide supportive care. So why are people paying attention to this Uganda outbreak if there have been previous outbreaks in the past? Well, this is a pretty big one so far. And the most famous one, as I mentioned, really, it can be very, very serious, over 10,000 deaths. This particular strain, there is no proven vaccine. And there was a death reported in Kampala, which is the capital city of Uganda, a city with over 1.5 million people. And whenever a highly infectious disease is diagnosed in a big city, there is always concern of the ability of it to spread rapidly. Now, in this case, it was a person who came to Kampala in a critical condition, and the healthcare providers were aware of it, and they were careful about protecting themselves and others. But because of the 8 to 10 day average incubation period, it is possible that this person exposed other people on his way into or in Kampala. Some of them may develop Ebola and expose others. And so that's the real concern at this point, is that this person or others may get an infection into one of the big cities, at which point it would be hard to control it. There's always concern about tourists getting exposed. Both the Europeans and the Americans say that this risk is relatively low. Prior to COVID, there were 1.5 million annual visitors to Uganda. That number's been cut about in half. But generally speaking, most of the Ebola cases have been in parts of the country that tourists don't go to. So is it an issue of concern? Yes. Anytime you see an evolving infectious disease, especially one that has been as serious as Ebola has been, it's an issue of international concern. At this point, there's nothing specific that we all need to do except to be aware that it's happening. And of course, as always, to advocate to be sure that those countries that can provide support to those countries that need it. Because if this were to get out of control in Uganda or the Democratic Republic of the Congo or in West Africa, again, it could impact us here as well. So it's really important that the international organizations, international countries provide support to Uganda as they request it and as they need it. A great deal more information about public health issues on our website. Please, as always, if you know of anyone who might wish to watch these videos, please feel free to share them. As always, thanks to Dara Young for editing, producing, adding captions, and posting this video. And if there's any topics you'd like for me to cover or any questions, comments you have on what I've said this week, please let me know. I look forward to hearing from you. Until next week, please be well.